Now, we have finished our discussion on maternal mortality. And I want to take you to the second aspect, which is perinatal mortality. The objectives of understanding this topic is to be able to define what is it, to appreciate the importance of studying perinatal mortality and morbidity, to know the cause of perinatal mortality, especially in this environment, and how to reduce perinatal mortality. Perinatal death is stillbirth plus early neonatal death. And according to WHO, stillbirth is the death after viability but before delivery, or death of a fetus after estimated gestational age of greater than 28 weeks or birth weight of 1,000 grams or more. There are other countries who have different figures, especially in terms of reference to gestational age. Some use 24, some use 28, some use 500 grams, So, but after a couple of years, it has been realized that the best chances of survival with good quality of life tend to be related to gestational age greater than 28 weeks. And that's why they finally adopted 28 weeks as the cutoff line. Early neonatal death is the death of the infant within the first week of life. That is day 0 to 6. So we use perinatal mortality rate to measure perinatal deaths from one country to the other. And perinatal mortality rate is perinatal deaths per 1,000 total births. Pay attention. When we were defining maternal mortality, we use live births at the denominator. Here we use total births. That is stillbirths plus live births. Importance of perinatal mortality. At around 2018, there were 5 million perinatal deaths annually worldwide. 50% were stillbirth and half were early neonatal deaths. And more than 90% of these perinatal occur in the developing countries. Perinatal mortality rate is related to maternal mortality ratio. So any effort geared towards reducing perinatal mortality rate will impact positively also on maternal mortality rate. Perinatal mortality rate is directly correlated with prevalence of malnutrition, mass poverty, high literacy level, and poor health care services. You can see the connection between the two of them. Perinatal mortality rate is a sensitive indicator, that's one of the importance, of the health status of women in society and the level of socioeconomic development. For instance, if we want to compare United States of America and Finland, and which country is more developed, most likely are likely to look at the armed forces, the military strength, the naval, so on, so on. No. It's perinatal mortality rate that reflects the quality of life, because that is one that is related to quality of life. Perinatal mortality rate is far, far lower in Finland compared to the United States of America, which means people born in Finland or who live there have better quality of life. And so it is assumed that it has a better socioeconomic development. There are classifications of perinatal mortality. We have two broad classifications, and then each classification is subdivided into 3. We have low birth weight, perinatal mortality related to low birth weight, and the one related to normal weight. Low birth weight, that is weight less than 2,500 grams. So, and they can subdivide it into intrauterine fetal death, first stillbirth, and early neonatal death. Any of these can be subgrouped into those occurring. There can also be subgroup those occurring within the hospital or outside it. Then there is a group of perinatal mortality associated with normal weight, which can also be subgrouped into those intrauterine fetal death, first stillbirth, early neonatal mortality. So they can also be subgrouped into those occurring outside or within the hospital. Let's look at perinatal mortality rate around the world. It's 18.4 per 1,000 as average globally. In developing countries, we have 11 per 1,000. North America has 19, Europe is 13, Latin America and Caribbean 21, Africa 62 per 1,000, Pakistan has 40.7 per 1,000. Nigeria has one of the highest. I start them, so they follow each other, first, second, third. Nigeria has 32.7 per 1,000, and Sierra Leone 30.7. These are just for example. The figure for Asia there is missing. Try and check that up. Correct it later. Predisposing factor to perinatal mortality include environmental factors, one. Secondly, biosocial factor. Thirdly, obstetrics and gynecological factors. When we talk of environmental factors, we start from poor or lack of electricity. It's very important because many of the services, many of the processes that are linked to good health services and good quality of life have to do with electricity. The same thing with inadequate water supply. It has to do with quality of life. Worsening economic hardship through wars and famine is also there. Rural residency. People who rural areas have poorer access to health resources and health services. Poor communication facilities, including transportation. Especially those who live in rural areas and geographically inaccessible environment. Malnutrition, environmental factors, unfavorable cultural and religious belief, and poor health facilities. These are all environmental factors that may contribute directly or remotely to perinatal mortality. Biological social factor. Maternal age above 35 years, parity greater than 4. We can see the relationship of these biosocial factors with the causes of maternal death also. Elderly primary gravida, teenage primary gravida, low-income earners, unbooked mothers who receive no antenatal care, poor physique associated with pelvic contracture, poor level of education, and poor status of women, and harmful traditional practices. They are all linked directly or indirectly with perinatal mortality. Then obstetrics and gynecological factors include previous abortion, which may lead to recurrent preterm delivery, antepartum hemorrhage, which may cause early intervention leading to preterm delivery, prolonged labor, assisted delivery and birth trauma, severe maternal and intrauterine infection, birth asphyxia from any cause, respiratory distress syndrome and apneic attacks, obstructed labor, low birth weight, which can be due to prematurity or intrauterine growth restriction, malpresentation and breech delivery, which are also linked with prolonged labor, obstructed labor, or birth trauma, prolonged premature rupture of membrane, multiple pregnancy, which also are linked with other issues like preterm delivery too. Prolonged pregnancy, medical disorders in pregnancy, diabetes, hypertension, sickle cell disorder, then assisted conception too. So in all this, early intervention may be there, and this contributes to morbidities. Prevention of perinatal mortality. We group prevention into primary, secondary, and tertiary prevention. Improve family planning services and its utilization will go a lot to prevent perinatal mortality. But if you can remember, by preventing pregnancy that come too soon, too frequent, and too much. Improve nutrition for girls and the whole population, and control of endemic infection. Poverty reduction through good governance, increase universal basic education for all, including female sex, good transportation system. Secondary prevention, skilled birth attendants to enhance early breastfeeding and detect complications and make appropriate referral when necessary. 50% of women globally still deliver at home. And until we improve on this, we will not be able to meet our sustainable development goal. Improve maternal and child health services to provide good continued care through pregnancy, labor, and preparedness. Universal provision of essential obstetric services at the primary health level and strengthening of referral system. Improve health services, infrastructure. Continuous upgrading and updating of staff knowledge and skills. Tertiary prevention is which are restricted to specialist center or hospitals. That's early detection of high-risk fetus, antenatal fetal surveillance with electronic gadgets, appropriate time delivery, and intensive neonatal care. In summary, perinatal mortality is an important indicator of maternal and child health in any country. The current perinatal mortality rate in Nigeria is unsustainably high. Perinatal mortality rate in developed countries can be improved by interventions that target improving the quality of lives of women and universal provision of essential obstetric and newborn care. Thank you.